My name is Zhao. I'm one of the Chief Residents this year, specifically the Firm 1 Chief Resident, and I went to medical school at the University of Texas Health Science Center at San Antonio. So ever since day one, like in orientation, I've loved my co-residents. We always say that we have a very strong sense of community, and it's 100% true. These are people who I basically grew up with in my medical career. We support each other a great deal. I could not imagine getting through residency with any other group of people. Working with some of the senior faculty has also been a really rewarding experience. They really value the education that the residents get. They're also regularly attending on the floors or the units with us, or they're part of the consulting teams that we interact with when taking care of our patients. So we work with them very regularly, and they're always extremely supportive. So when we were first getting our COVID patients in the hospital, I was actually working on the general medicine floors, and that day felt unlike any other day I've ever experienced in my life. It was one where I felt very empowered in my ability and skill set to take care of patients. And even though the times were very uncertain, we weren't totally sure what the clinical course of these patients was going to be, but I think that with the enormous support we had from our program leadership, and also our Department of General Internal Medicine and hospitalists, all of that came together and created an environment where I wouldn't have wanted to be anywhere else taking care of these patients. So looking back from my intern year up until now, I think the biggest change in myself that I've noticed is my confidence and advocacy for patients. We work within a very complicated healthcare system, and helping patients navigate that system is extremely rewarding, and also being that spokesperson for the patient and trying to be their cheerleader and their support staff. It takes a lot to reach confidence in being able to develop those skills and knowing that your skills are there. And I would say that my confidence in my ability to be an advocate for patients is the biggest change that I've noticed.